You know, every year coming here has got to be one of the most uplifting things that I do or have the experience to be a part of. Juliet, my wife, and I, and my team, there is more good that happens here than at any conference, any medical conference I've ever been to. And the reason is, it's because of the involvement of families and people, not doctors, where you have to wait on information to be disseminated, and I hate that word, trickle down, but end up, coming to you. And now it's much more available on the internet. And in fact, I don't know if any of you have ever heard of MUMS, Mothers United in Moral Support. It was a support group started in...
It's hard to hear you a little bit.
Oh, you want to turn me up? Okay, is that better? MUMS, Mothers United in Moral Support, which was a support group started by the mother of a cerebral palsy child. So this was a preemie baby, and proportionate to how preemie you are, the frequency of spontaneous brain bleeds goes up, which leads to cerebral palsy. And that's what happened with this little baby in the hospital. And mom was sent home with this badly neurologically injured baby in, I want to say, right around late 70s, right around 80, and just told her, take her home. And I said, well, gosh, how do I care for her? There was nothing out there, nothing. And she started this organization on her own. It was a parent-to-parent network connecting parents. And eventually it was all over the world, 50 countries, all 50 states. And long story short, we're so far beyond this now. And it's come to what, in 1998, I told Dr. Richard Neubauer, who was one of my mentors and who had been doing hyperbaric oxygen for neurologically injured patients for a good 12 years before he and I connected. And, he taught me some things and so on. In 1998, we wrote a book chapter in an International Hyperbaric Medicine textbook. And what I was showing was the brain imaging on the children we had treated before and after hyperbaric oxygen, telling the stories that some of them were drowned children. There was a child with shaken baby syndrome and such, and some others. And the message of it was, the very last paragraph, I go back to it all the time, is that the spread of this is going to be facilitated by computer-assisted dissemination of information directly to the public. And that's where we are now, so that people are more aware. You've got these tools and things that you can go out and get for your children. Okay, so a little pre-ramble there. What I want to talk about today was dosing of hyperbaric oxygen, and this is kind of a key issue, and really the punchline's coming at the end, where I want to show you what can be done right now for many patients. And it's normobaric oxygen. And the central message of this is that, hyperbaric oxygen still today is probably the most effective, wide-ranging, and panoramic therapy that has ever existed. But access to it is still a problem. And before you can get that, there's a way you can get even part of that therapy, and that's what we're going to talk about. If this works. Oh, there it is. So I wanted to start with just a simple question, is what is hyperbaric oxygen therapy? And that sounds so stupidly simple, but it's been an unanswered question since 1662, when the first hyperbaric oxygen or hyperbaric therapy was begun. And it's led to just all of this confusion, misinformation, the medical profession not understanding it, disparaging comments if you maybe talk to your pediatrician or neurologist about this. And it wasn't until 2008 that we finally had the answer. So what I want to do is go back to the beginning and talk to you about what this therapy really is, so you understand it and what you're doing when you finally come to get hyperbaric oxygen for your child. This started in 1662, if you can imagine. And it was a British clergyman and physician who did this. And built a chamber, and what he thought was elevated pressures could help people. And elevated pressures, the higher pressures were good for acute diseases, and the lower pressures for chronic ones. Believe it or not, that's still true today. And in fact, if you look at that chapter that I wrote there, it was for acute treatment of the equivalent of drowning. Global ischemia, where the heart stops, brain gets no blood flow. And what I showed is that things change, the pathology, as you go from the event out even years, and that hyperbaric oxygen, the dose of it changes in terms of responsiveness of the brain to it as you go out. Well, what ended up happening is that, boy, we got a little glitch here. I don't know if you remember RoboCop. But that kind of skipped ahead. I'm trying to go backward here. What happened? Wow. We got a little problem, Houston. Can you, this jumped ahead like 20 slides. I may have to have you manage it. Okay, go next. Let's try again. No? Okay, there we go. So what ended up happening, by 150 years later, there were hyperbaric chambers throughout most of the major cities in Europe. And they were treating at 2 to 4 atmospheres of pressure. Now, we're a little above sea level here, but sea level is 1 atmosphere of pressure. So 2 is the equivalent of a scuba dive, 33 feet below seawater. 3 atmospheres, 66. 4 atmospheres, 99. So they were treating people at a pretty deep pressure there. And they became known as compressed air baths, where you'd go in and soak under pressure for hours at a time. You can see these guys in the chamber, they're reading a book, passing the time of day. But what it meant was there were long treatment times. And they treated all sorts of different things and found success with it, but they assumed that the benefit was just due to the pressure. It turns out, though, that oxygen was finally discovered in the 1770s, and they realized that when you increase the pressure of air, you also increase the pressure of oxygen in it. So oxygen was a contributing component. And of course, that is what this little case was all about here, which was little Eden Carlson, the little drowned girl, who many of you are probably familiar with. And we'll talk about it a little bit later. You'll see the video. But by the late 1800s, suddenly hyperbaric medicine petered out in Europe. And nobody really understood why. So many people thought that, well, they were using it too much, claiming it worked for everything. And so it lost credibility. And that's something that is still claimed today because it's not understood. But the other thing that happened was people realized that pure oxygen could be toxic. And you could take a lark, which little animal, high metabolism, 300 heartbeats a minute, put them in pure oxygen for 5 minutes and they plopped over dead. So people got scared and that may have contributed to it, but what I really think happened was this. Decompression sickness was discovered, but I don't think people really put it together. So, if you go for a scuba dive or you go under pressure, even in a chamber, and breathe air, let's say, the oxygen's no big deal. Increases the pressure, you metabolize it, you use it, but the nitrogen gets dissolved in our blood and distributed to the body. Now when you come up from that pressure, like from a dive, you gotta come up slowly, or if you've been down too long, you gotta take some stops to allow that nitrogen to gas off. If you don't, and even if you do it right, at least 5% of all that dissolved nitrogen erupts in your bloodstream as bubbles. And that's decompression sickness, and it can also happen in your tissues. But what happened here was, remember I showed you, they were taking people to up to 4 atmospheres of air pressure. That's a 100-foot scuba dive. Take a look at a 100-foot scuba dive there. This is from the diving tables. From the time you leave the surface, jump into the water, dive down to 100 feet, you've got 23 minutes before you come up without incurring a big risk of decompression sickness. And the longer you stay down, you got to either make stops,
coming up to off-gas that nitrogen, or you end up with decompression sickness. Now remember, these were baths. They were treating people for hours. And I think what started happening is people were getting decompression sickness and they didn't know it. They'd go in the chambers, they'd come out, they wouldn't feel well. And the long story short, they died out. And so hyperbaric medicine was dead from 1885, roughly, until 1918. Not very long, 20, 30 years. And then what happened? Spanish flu pandemic, i.e. early COVID, or the first generation of COVID. No, really it is. It's a very, very similar virus in many, many ways. And what happened, there was a doctor in Kansas City, anesthesiologist named Dr. Cunningham, and he was vacationing in the Rockies. And while he was up there, he just got to thinking, well, why are all the people dying so much more in the Rockies who had Spanish flu than they were at sea level? I mean, still there were a lot dying at sea level, but in the Rockies, they were just, dropping like flies. And he thought, it's got to be due to the lower pressure and the lower oxygen. What would happen if we gave more pressure, more oxygen? It was like ding, ding, ding. Raced back to Kansas City, got an old boiler, converted it to a hyperbaric chamber. And the first day that it was operational, they had all these animal experiments planned. And they brought him this dying medical student. Spanish flu is described in a book and in a medical journal. He was literally agonal, taking his last breaths, gray in appearance, discolored. They put him in the chamber and they described on air, and they only went to 1.68 atmospheres. That's a little more than a lot of the portable chambers, but it was just air. And they described him, his breathing improved. He pinked up. 1 treatment a day, 4 days, they saved his life. Next thing you know, the guy was flooded with these sick, dying Spanish flu patients. Nobody knows about this. But this is where hyperbaric oxygen finally came into the United States. And if you look what happened there, he then built this 88-foot chamber, then another one, and finally saved a guy who was the guy who made a fortune in roller bearings, Mr. Timken. If you go online, you'll find Timken Engineering. It's a huge engineering firm in Cleveland, Ohio. Well, Timken was in renal coma and dying from renal failure, and he treated Timken, saved his life, and Timken said, what can I do? I'm going to build you a 5-story steel ball hyperbaric hospital. No kidding. And that went up in 1930s in Cleveland. But then the American Medical Association, God bless them, came in, got after Dr. Cunningham, and literally drove him to a stress-related early death at 55. He had a heart attack. This thing ended up getting melted down in World War II, made tanks and munitions and so on. But he had treated all sorts of people very successfully. And if you look at this, peculiar action of this treatment is the regeneration of nerve fibers. Ding, ding, ding. What are we doing? And he did it in patients with tertiary syphilis. Try the behind the back pass. Dear God, change the slide. There, we'll see how it works. And so what finally happened is, if you look back on this, all of this treatment was with compressed air from 1662 to the 1930s. And by the end of the 1800s, there was an article written by a doctor on a review of hyperbaric therapy. There were 300 references in it. 300 publications with doctors using this for all sorts of things. And the beneficial effect was thought to be due to just the pressure. Well, then what happened? There was the second reincarnation. The first was Dr. Cunningham. The second one came about when the US Navy realized, if you had decompression sickness, what do? You put someone in a chamber and you take them to the depth of that dive that they were at, plus another atmosphere, but on the same gas, air. Then you had to bring them out very slowly. And what the pressure did was compress all the bubbles in you. Well, they realized that maybe if we added oxygen instead of air, we're now breathing 0 nitrogen. So the nitrogen in the body can off gas easier. Oxygen can go in and exchange in the bubbles for air, and presto bango, you're better. And in fact, that worked. But then they had to find out, how much oxygen can you give safely? And the British actually did this. They put a bunch of military recruits in a chamber with inside observers on air, put the guys on oxygen, and sat there and watched them until they developed oxygen toxicity symptoms, including seizures. And that's how we found the limits of how much oxygen. Service to their country, I guess. But the Navy started doing this also, and finally they introduced oxygen into the decompression tables. But these Navy diving doctors now got into private practice and were using hyperbaric oxygen also. I said, wait, it worked for this. Why wouldn't it work for wounds and other things? And they started using it. And simultaneously, what happened, the Dutch started using it. They said, wait a minute. What conditions do we have a maximum lack of oxygen or a maximum deficit of oxygen? Gas gangrene, the flesh-eating bacteria, carbon monoxide poisoning, and blue baby operations. So congenital heart disease in children born with heart defects, they can't oxygenate their blood, and the repair form is take them into surgery, cool them down, anesthetize them, put them to sleep, and sew like crazy, you had about 15, 20 minutes to do what you needed to do. And then the child died. Or if you could do that in 20 minutes and wake them up, they were profoundly neurologically injured. Now that they could operate under pressure, the child with high levels of oxygen increased the operative time significantly after they stopped the heart. So what ended up happening, all of this came together and the modern era was born. Oh, got another glitch there. Oh, help me. I'm going to probably have to start speaking faster. Okay, there we go. And what ended up happening was, excuse me, out of this, a new medical society was formed. The doctors got together, the U.S. Navy diving doctors, and formed the Undersea Medical Society. And it was all based on the use of 100% oxygen. And they finally changed the name to the Undersea and Hyperbaric Medical Society in 1986. And it led to this definition, which has misled the entire hyperbaric medicine field now for 60 years. Hyperbaric medicine, forgetting all the 300 years with compressed air, was the use of 100% oxygen to treat certain recalcitrant, expensive, or otherwise hopeless medical conditions. And it had to be at that pressure or higher, 1.4 atmospheres. I'm going to tell you to this day, there is no science or literature to argue that. And for pressures less than that, there is no literature saying that hyperbaric oxygen doesn't begin at even lower pressures. But it's dominated the field and it's led to all of this confusion. And that word certain ended up resulting in, dear God, please change the slide. I'm sorry, we're having such trouble with this.
It's not you, it happened yesterday too.
Oh, did it?
Yeah.
Oh, thanks. Okay. What did I do wrong? Okay. So, well, what it ended up, that word certain diagnoses, was 15 diagnoses in the United States, but it had been used for as many as 132 over the years. And in Russia, 23, China, 48, Japan, 20, European, 22. This made no sense. Who determined certain in the United States? It was a little group of doctors that said, oh, it worked for this. Well, they had a plastic surgeon, so he put a plastic surgery diagnosis on there. They had an orthopedist, he put a bone diagnosis. They had diving doctors, et cetera. And that's how this list came about. And that the FDA bought, Medicare bought, and that's why you can only get this reimbursed for that list that's made up by those little list of doctors today that still controls that. And that's what I've been fighting for my career. But if you look at those 132 diseases, it spans this is bad karma. There you go. Here they are. I mean, you can get lost in this, but this was a critical article written by doctors who didn't understand hyperbaric therapy saying, look at all these things. The title of the article was Hyperbaric Oxygen, a therapy in search of diseases, meaning it's done for everything and there's no reason for it. It turns out if you look at all of these, they are wounding and inflammatory conditions. And here is some more of them. Quadriplegia, bronchitis, ulcers, Look at the itises on a number of these. Itis means inflammation, inflammatory conditions. Can you advance this? There we go. And so based on this, it made no sense. Nobody could figure this out. And when I came into this field and realized what we were doing, we're not treating a disease. We're treating the underlying disease processes. And these processes are common to many diseases. So we're using increased pressure and increased oxygen. But based on that definition and what was in the field, I thought it was all due to the oxygen. Turns out I was wrong. Dr. Neubauer and I. And so what we did, I finally went to the Food and Drug Administration in 2008 to get their sanction on a study we were doing on veterans and people with traumatic brain injury. And I asked them for their sanction that if we had positive results with this study, we could use it for a new FDA indication for hyperbaric oxygen. Well, for the first time, hyperbaric oxygen had been moved from the devices side of the FDA, there are 3 divisions, to the drug side. Because why? 100% oxygen is a prescription medical gas. And this was the first time they had ever had an application on hyperbaric oxygen. They said to me, look, we don't know anything about your therapy. But this is the first, even though we oversee it. But we view your therapy as a combination drug of 2 things. You put someone in a chamber, you increase the pressure and you increase the oxygen. You got to do a whole bunch of experiments with different pressures and oxygen levels. And I thought, these people are crazy. This is what people complain about the FDA. Maybe I need to pay them. I don't know. I couldn't figure it out because I'd been in the field 25 years. No one ever mentioned the effect of pressure other than in treatment of divers where you have separated gas, compress the gas. So I went to the library, and what did I find? Essentially, that was what they told me. 50 years of elegant physiology. The PhDs had done experiments showing that bioactivity of pressure spans the entire phylogenetic spectrum of living organisms, from yeast and single-cell organisms all the way up to humans. You could even think of this from a couple standpoints. Creation, well, we're just born that way. And that's the way we were created, to be sensitive to oxygen and pressure. But for people who believe in evolution, we supposedly came out of the oceans. And I'm going to show you something about that. Animals and plants are distributed in the ocean according to the pressure that they're at. We are all sensitive to pressure and to changes in oxygen. And here was the article, and look at the pressure range in this article. That 1.0015 atmospheres, that's a fraction of a centimeter of pressure, water pressure. So, atmospheric pressure is like 30 inches of water. So, we're talking about just a tiny bit here. And 1.3 is the level of the FDA approved chambers for mountain sickness. And so I summed it all up here. And if you look at these pressures, that living organisms respond to these and elaborate all sorts of chemicals and proteins and enzymes and so on. And it begins it's been measured within 1 to 3 minutes of shutting the door on a chamber and pressurizing someone. And it was a whole new world. Nobody understood this prior to, except PhDs, but doesn't get into the clinical arena. That's the equation for all chemical reactions in the universe. Every chemical reaction in our body, that's the chemical reaction showing the amount of free energy that gets liberated. And what's right smack dab in the center? Pressure. All chemical reactions are sensitive to the pressure that we're at. Think of going to altitude, how you feel at altitude and so on. So what happened is we redefined this therapy as a treatment for disease pathophysiology based on pressure and oxygen and potentially other breathing gases like argon, if you have argon in the mix. And essentially increased pressure, increased oxygen, treat the disease processes, treat the disease, and change the slide. This led to new definition where this now defines and encompasses this whole field. And it's a publication we put out. And what it shows is that this big white circle is any living thing that's exposed to just pressure. But within that pressurized environment, if you're something that breathes, the breathing gases then are part of that and the therapeutic effect. And 100% oxygen can be one of the breathing gases. But you don't have to necessarily have. What if you have 90% oxygen? You're still in the green circle. Or 40% oxygen. And so what this has done now is kind of tie the whole field together. But still, what about pressure? People didn't really understand pressure. So what is pressure? Barometric pressure. It's something we live with, but we don't think about. So the pressure that we are all scuba divers at sea level right now. We're under 1 atmosphere of pressure. We have a certain amount of nitrogen dissolved in us. And here is the pressure graph. This is so busy, but all I wanted to show you is, here is from no pressure outer space, well, 60,000 feet and above, 0 pressure, all the way up to 1,000 feet below seawater, or PSI, excuse me. Here is the pressure range that hyperbaric oxygen is operating in, and right there is what we're living at sea level. So this is the safe region, but there's a wide range of pressures that we can live under and thrive. Above it, you need some oxygen. Below it, you're okay. But just to show you, different species of birds live at different altitudes and thrive at different altitudes. Similarly, flora and fauna, so plants and animals also have an optimum environment based on pressure and oxygen. And you see them at different altitudes. How about when you go underwater? The plants are distributed, their species, by their pressure level in the water. And it's the same with fish. You find some fish in shallow waters, others in deeper waters, some that can traverse all of them, like whales. Okay. So atmospheric pressure, we can think of in a couple of ways. Atmospheric pressure is the weight of air from sea level all the way up to about 100 kilometers in the atmosphere. So all of that weight of air is what's on us right now. 14.7 pounds per square inch of air, all right? If we go underwater, it only takes 33 feet of water to get the same amount of pressure. And all of that is bioactive. But also, I want you to think of what happens when you blow up a balloon. You don't have all that weight of air. But that increased putting more air into a confined space, it's now under pressure. It has force to it. And it is a little heavier because you put more into it. So just a balloon with air, if you let go of it, it falls. Helium, which is lighter, of course, will rise. But what happens also when you just put your fingers together? Pressure is exerted. It turns out our entire body is filled with pressure sensors, such that, it's the way we feel when we touch and so on. But what happens is that little pressure deforms cell membranes, which are connected to the nucleus, and through vibration, messages are sent electrically and through vibration to the nucleus, and gene expression can happen. So the only way, unfortunately, we have to expose our whole body to pressure is to put you in some type of enclosed vessel and turn up the pressure. And that's what a hyperbaric chamber is about. And I eat my own cooking. This is my son who was in the chamber for... Somebody's trying to tell me something. So it turns out when we deliver a hyperbaric treatment, every chemical reaction in our body is potentially affected once that chamber door is shut and you turn up the pressure or you zip into it. But what else is affected? And this is the other game changer that happened. It was proposed in 1997 that since we grow new tissue and heal wounds with hyperbaric therapy, you have to stimulate cells to multiply and divide. To do that, you got to go through the nucleus somehow to make it. That's where the division occurs and is stimulated. And nobody really put it together. But over the next 10, 15 years, people started doing experiments where they looked at a single gene product, like the hormone that stimulates blood vessel growth. And they found that hyperbaric oxygen increased it. And what happened, though, is molecular biochemical techniques advanced enough to now where you can take one of your cells, reproduce them, or just single cell, put it in a petri dish, expose it to hyperbaric oxygen, now measure gene output over 24 hours. And what they found is a single hyperbaric treatment for human cells, the cells that line our tiniest blood vessels all throughout our body, which are the most reactive cells in our body. At the end of 24 hours, 8,101 of our 19,000 genes are turned on or turned off. There is nothing like it in all of medicine. And nobody ever knew this. And it turns out the largest clusters of those genes that are turned on are the growth and repair hormone genes, i.e. grow new tissue, and the anti-inflammatory genes. Now go to all the itises on those conditions I showed you. Largest clusters of genes turned off were the pro-inflammatory genes. The ones that caused inflammation are turned off. And the genes that code for programmed cell death. So every time you go in a chamber, you're stimulating tissue growth in damaged areas, inhibiting inflammation, and turning off cell death. Wow. And that's what's been going on for 362 years, and nobody really understood this until finally the FDA made this simple observation. We don't know anything about this, but hey, you're doing this. And went to the library, and there it all was, right in front of us. And now we're trying to disseminate all that information. So, what are we doing? We're taking advantage of our body's sensitivity to pressure and oxygen to stimulate change and damage to underlying tissue. And we do this in wounding conditions. So what is a wound? Well, there are a lot of definitions here. You know, we think of it usually as an external wound. You get a cut, you get a bruise, you scrape yourself, etc. But internal wounding, a stroke, a heart attack, a variety of different conditions where you deprive oxygen, even trauma to your internal organs. And you can think of these, you know, external wounds, they're pretty common. That's a burn up there on the right-hand side, and that's after hyperbaric oxygen. The number one treatment for swelling anywhere in the body, which is what we're also treating in the brains of brain-injured patients, children. That swelling, I just have a young woman, 21 years old, who has an arteriovenous malformation in her brain, and it bled years ago. Mother found hyperbaric oxygen, we treated her, and she had a remarkable improvement in recovery. Well, 10 years later, they decided to go in because it's growing a little bit, and they did a radiofrequency ablation, which is, you know, heated up and kind of burned some things. And, of course, a lot of swelling when you damage tissue. And now she's paralyzed. And they brought her in, and we treated her again, and now she's got function. It's not yet back to normal, but she can use the hand, grasp, walk. She's normal looking again. It speeded up cognition for her. It's really remarkable. She just went and saw the neurosurgeon last week, and they repeated the MRI. And he looked at it and he said, I have never seen anything like this. This just doesn't happen. What'd you do? Well, I tried to tell you, I was going to get in the hyperbaric oxygen for you. He says, wow, you mean that works? But we also, a broken bone, an internal wound. And how about the brain, a stroke? So let's go to that list in the United States. The only things that get reimbursed with hyperbaric are for hyperbaric oxygen therapy. And all of them are wounding conditions. Air in arteries that go and cause strokes or heart attacks, carbon monoxide poisoning. It's a wounding to tissue, vessels in the brain, the whole body actually. Crush injuries, that's an obvious wound. Decompression sickness, bubbles in tissue that cause wounds, essentially. Problem wounds like diabetic foot wounds. Exceptional blood loss anemia, where it's a reduction overall in oxygen carrying capacity that insults the body. Radiation damage, I don't think you need to imagine that as a wound. I mean, it's so easy to imagine. And skin grafts and flaps that aren't healing, thermal burns, central retinal artery occlusion. It's just stroke of the eye. Sudden hearing loss, same thing. It's almost like a stroke of the inner ear. And then these are all the infectious ones, which essentially are wounding conditions. Think of abscesses in particular, but they're all wounding conditions. And now it kind of begs the question, what else? Well, what's the difference between any of those and a birth injury? People are familiar with this. Difficult birth, the baby comes out with a misshapen head, bleeding underneath the scalp. Well, that's just on the outside. What happened on the inside? Oh, the baby's okay, everything's fine. No, the baby's head got so squeezed in the birth canal, blood flow drops. When you have increased pressure in the brain, the arteries pumping blood into it, the carotid arteries and vertebral arteries, the blood flow drops. Now what do you have? An ischemic insult to the brain, low blood flow. And of course, the typical thing with cerebral palsy, scissoring, spasticity, and so on. And all they're showing here in this is just the bleeding on top of the brain. That's on the outside. But internally, there's also damage. So what are the most common disease processes in wounding? It's low blood flow or absence of blood flow, low oxygen, and inflammation. And it turns out all of these things are treated by hyperbaric oxygen. And what is one of the conditions where you see this type of problem is autism. Autism was defined in the 1940s. It's a psychiatric condition in children. Does that make any sense? How do you get a psychiatric condition where the kid doesn't speak, won't look at you, is in his own world? 2 years of age? 18 months of age? I mean, it's just total nonsense. And now and that is what was used, that psychiatric designation, to deny parents insurance reimbursement for any therapy they were trying to do. You know, most insurance policies, you got what, $2,000 for lifelong psychiatric care. $2,000, that's it. With all of the biology that's now been discovered about wounding and injury, and what are the primary areas of the brain injured in autism, functional brain imaging studies shows temporal lobes and frontal lobes. And what can cause that? A variety of insults. First 5 children that I treated were all birth injured children. But vaccines have been implicated, all sorts of different things. Much of it, we don't even know what's causing it, but it's an injury to the brain. And there is an autistic child, one of my children that we treated back in the day when we were formally doing studies and with imaging. Everybody I treated had to have a brain blood flow scan, next day in the chamber, certain dose, repeat scan. Repeat scan at 40 treatments, at 80 treatments, and so on. This is the 3-dimensional surface reconstruction. Take a look at the temporal lobes. They're all hollowed out, meaning the blood flow there is markedly decreased. And these are the areas of the brain and the frontal lobe. So your eyes would sit right here. You're looking at the person face on. This is behind your forehead, our frontal lobes. Parietal lobe up here, in the back are the occipital lobes. These 2 areas here also damaged are our cerebellum. In the back, the areas that control coordination of thought and movement. Here are the temporal lobes. So if we look at neurological and intellectual disability in children, look at all of these. They're wounding conditions of the brain. Many times we don't know what the wound is. Many times it occurs at birth and it's not identified because of the liability situation. As much time and distance is put between the event and final diagnosis, parents forget, medical records get lost, etc. But there was a imaging company in Denver, Colorado called Sarascan. It was the 4th generation. It had been bought, sold. But the last guy who bought it was a big data guy. Made $750 million, sold his company for, taking massive amounts of data and using big mainframe computers, crunching data, etc. It's now kind of what AI is doing. He was early in it. And as a hobby, he bought the imaging company that does that type of imaging that we've been doing for years, spec brain imaging. And what he decided to do was go back and 3,500 people that had come for spec brain imaging for psychiatric and neurological diagnoses. People couldn't figure out what was wrong with them, and or they had a diagnosis. And they got their medical records by permission from birth all the way to the time of imaging. And he hired coders and data collecting people and so on to go, and they made a 1,700 column Excel spreadsheet. Think of that. How many times do you have to scroll right? And they entered every piece of medical data. And in the end, pushed the button. And what'd they find? 60% of the 3,500 people coming to them referred for SPECT brain imaging for, neurological and psychiatric diagnoses had a significant birth event. In my book, I talk about one of the most dangerous and traumatic trips in life for many people is the trip down the birth canal. You think of it, the head gets squeezed. And if you're stuck for any period of time or engaged, and this is the problem with inductions, it's so unnatural. And that was the first cerebral palsy child treated in North America. I treated in 1992. And it was a mother who, for convenience, the doctor, they decided to induce the child because he was going on vacation. And he doesn't get reimbursed for the delivery and all of the prenatal care unless he delivers. So, induced. Gave her a dose of Pitocin, and it didn't work. Doubled the dose. She went, first-time mother, from contraction to delivery in 45 minutes, and described it as just violent, painful birth. And this little kid born jittery, low oxygen level, subarachnoid bleed, and just terribly injured, till we treated him. So anyways, wounding conditions. Oh, there we go. So now we look at things. If we look at all these different diseases and go back, they're inflammatory conditions and wounding conditions. And my experience now is treating probably 100 different conditions, maybe 80% of which are neurological. So the central question, we're getting to the end here about this, is I ask parents to try to answer this question: does your child have a wound in their brain? Either from birth or from some event. You don't have to necessarily identify it, but could there be a wounding process? And if so, we now have evidence that hyperbaric oxygen can be, I don't want to offend the other doctors, one of the most effective therapies for your child at any point in the injury process, sooner rather than better. But then the question is, well, what dose do you use? How much oxygen? How much pressure? And that's a little tricky. And what I tried to do, I wrote an article about this. There's a book chapter, and it was unfortunately kind of innocuous because this is my mentor, Dr. Neubauer's conference, the Second International Symposium in '99. And what happened, I had all of this imaging we had done, this beautiful imaging. We were so blessed. We had the world's best scanner, really, at my little community hospital. How it got put there, it just, I think it was divine intervention. But the point was, we had these beautiful scans. He had a scanner, it wasn't quite so good, and he was the one who had discovered use of this. He didn't want me showing all of these pictures. So he asked me to give this talk on the dose of hyperbaric oxygen, how to do this in neurologically injured patients. And what I showed was 35 cases of too much, meaning, and how you got to too much. But in the process was how you did this. Well, it was in a book chapter. You're dependent on everybody buying the book. It didn't get out there. And so the thing's out of print now. So and half the cases actually were from parents who called me up who had problems. We went and got this therapy. You said this worked. We saw this stuff you presented at a lecture, and now my child had a problem. And I put all these together, and finally what happened, we had a number of children who had died from chambers that parents put in their home that went to an atmosphere and a half. And they treated these children who, both of them 8-year-old little girls who had severe trauma and seizures. And the children got better initially, and the seizures went away. They kept treating, the seizures came back. They read that Dr. Neubauer, we had successfully treated seizures, and they kept treating, the seizures got worse, and both children died of seizures. And there are others in here, in portable chambers where people treated too much and so on. And the whole point, though, is if you read it, it's 60 cases. So you can read each of these, but what's embedded in it, and one of the reasons they wanted to hold up the publication of it was one of the reviewers said, we don't know how to review this. These treatments and what he's describing, what's been done, these outside cases, there are pressures and durations of treatment that's never seen in hyperbaric medicine. And inadvertently, if we approve this article with the complications, we're endorsing this treatment. So I wrote back to him and I said, look, I understand this, but you need to know how this happened. And I told the story of all of this confusion. And this is unprecedented in an article. The reviewer wrote back and said, please, nobody knows about this. Put it in there. So if you pull this article up, at the end is 2 pages of what's called a caveat. And it tells the story of all of this problem and how everybody has gone out based on misinterpreted studies, but the data was there to show this worked for children or for people with traumatic brain injury, but they didn't know how to do it. They went about it the best they could. Now we do know more how to do it. But this was, looking at side effects. And the other thing that happened is I got invited to have a special research topic for a neurology journal, Frontiers in Neurology. It's an open access journal. You guys can all go look at the articles, pull them up. Getting back to computer-assisted dissemination of information worldwide. And what happened was one of my colleagues up in Montreal, after we had treated these cerebral palsy children, they had experienced some of these kids that went over to England from Montreal to get this treatment in the late 90s. He saw them improve. They did these studies. And the problem was, and we won't get into it all, there was a design error made in the experiment. And the control group got hyperbaric air and they improved. And nobody understood it. New science, remember, that's 2001. 2008 was those articles I showed you, FDA 2010. So it was, no one understood what was happening, but the data was there to support it. So what happened was, if you look at cerebral palsy, there's a measurement of the motor deficit. It's called the gross motor functional measures. Developed in Canada, it's well published now. Anybody doing a study on CP kids measuring their motor function uses the GMFM. So they've got GMFM scores on thousands and thousands and thousands of children over their childhood up through about 16 years of age. So Dr. Marois, the lead author there, who had seen this in children, doesn't have chambers. He's a pediatric physiatrist. They couldn't get chambers in their hospital. They couldn't, get this done. They went and took all these thousands of curves and figured out a mathematical equation that was 99.9% predictive. So if you have a child with cerebral palsy, and let's say he's 2.5 years old, you do a GMFM. The physical therapist does the whole measurement and puts them through walking, crawling, rolling, all of these things, standing, balance, whatever. And they get a score. They can now take that score and tell you in 3 years, 5 days, exactly where this child is going to be. And the beauty of it is, what it now allows you to do is take every study done on cerebral palsy children that's been done where the GMFM was used to measure outcome. And it allowed you to compare them over time. And he had been showing this at lectures, and I finally said, Pierre, I'm going to beg you, please submit the article. We'll get it peer-reviewed, etc. Here it is. Here is the GMFM evolution ratio, which is that mathematical measure. And here are all the therapies. Common physical therapy, once a week. Yeah, it has a little bit of improvement. Intensive PT, once a day, 5 days a week. Very intensive PT, at least a couple times a day, multiple times a week. Selective dorsal rhizotomy. That is cutting the dorsal part of the spinal cord and or the sensory nerves. So you take away the sensory input from the legs or arms, the paralyzed parts of the body, spastic parts. And in the absence of that input, the spinal cord can't give its reflex of tight motor. So it makes the kids more pliable. But you're cutting nerves. It's a permanent change. Same thing can be done with hyperbaric therapy. Botox, everybody's familiar with that. Hippotherapy, horseback riding. Horseback riding has a beneficial effect on children with CP. Stem cells and hyperbaric therapy and hyperbaric oxygen. These values are 4 times the average of all of these. 400% improvement. compared to the average. There is nothing like this ever in all of medicine. Nothing. And it's irrefutable. And then here's the one clever experiment they tried to do where they gave them hyperbaric air, but they dropped the oxygen level so that it's just pressure and the amount of oxygen we're breathing here. And they prematurely stopped the experiment because they said both groups, that and the high oxygen group, had the same amount. Well, it turns out, look at that. It was equivalent to all these other therapies. What it said, though, you needed more oxygen. So, what if you can't get hyperbaric oxygen? What you can try to do and start with is normobaric oxygen. And what is that? We're all right here living, breathing air that's 20.9% oxygen. That's being used as what's called a respiratory metabolite. We're using it to burn sugar, fat, and protein, burning our fuel. And that gives us life. But what happens when you increase the oxygen level for a period of time and take it away? We all know, and this has been shown, if you increase the oxygen level and you leave people on it, you don't get a lot of benefit from that unless your whole oxygen level in your blood is low. Then yes, it sustains life. But if you do it intermittently, it no longer acts like a respiratory metabolite. That excess oxygen acts like a drug. It's like giving yourself a pill of oxygen. And it has drug-like effects on gene expression, as well as other things, and you can even stimulate repair of wounds. So what happened was, we found in the 1980s that patients in our wound care center getting hyperbaric oxygen for their diabetic foot wounds, radiation, et cetera, and they ran out of reimbursement time. The hospital kicked them out, no more money, no more treatment. We ended up sending them home on an oxygen concentrator. So we didn't have the pressure, but we'd give them oxygen every day. In fact, this is what Dr. Neubauer did in 1990 with the first patient, stroke patient, 14 years out, who they did the study with the brain imaging. And they gave her then intermittent oxygen by a face mask at the nursing home and brought her for hyperbaric oxygen. Well, we would send them home on the oxygen concentrator. They wouldn't heal as fast with the hyperbaric oxygen. It was much slower. But they still went on and could be stimulated. I then used this in some neurological patients. And we had the same result. Very slow, but still, it was an improvement. And then along came little Eden Carlson. We're going to look at this video in a minute. And then after her, little Aiden El-Jiriri, whose video I'm going to show you also. And now well over 100 children in ICUs all over the United States. Birth-injured babies, drowned children, kids with catastrophic brain injury of other causes, and even internationally. We've had doctors in other, like Morocco, do this. It turns out there are scientific references where this has been used in acute stroke, acute severe traumatic brain injury, and a number of other pathologies. But why aren't we using it? Doctors aren't aware of it. So what I want to do, we're going to end with these two little videos. Go ahead and play this one. This is little Eden Carlson, the little girl who drowned. And this now is 2 months out of the hospital. She's at home, and this is her condition. And they had just started some new drugs, loosened her a little, but here she still is. And parents called me, and you can see the abnormal motor thrashing. And I told them, look, you were sent home with the oxygen to try to rescue her when she stops breathing and falls asleep. I want you to use it as a drug. And we started that twice a day, 45 minutes, and there she is 1 day later.
Eden, is that your movie?
There she was 2 days later.
Can't tell. Because if you tell a wish,
Now you tell me
it won't come
it's
true.
not a difference. And what ended up happening, and you can stop that one, when she finally was stable enough, the reason I started this was they live in Fayetteville, Arkansas. I'm down in New Orleans. That's about 8 hours of woods, hills, farmland. I couldn't have them put her in a car and this little girl stopped breathing out in Podunk, USA. No hospital, no resuscitation, dead baby. You can just imagine how that'd play on the news. Family desperately driving to New Orleans to treat with this unproven therapy, dies in a cornfield, town of whatever. And so I used this to strengthen her to where she'd no longer fall asleep neurologically, or I should say stop breathing when she'd fall asleep. And that was at 13 weeks. They came down, and the other video then is when we added pressure to this and what happened. Well, at that point, it was very obvious we could do this in children and do it very safely. And now ICUs around the country, the pediatric ICUs, are having experience with it, and they're starting to do this. We just did it with 2 drowned children in Hawaii. But there was a mother in Morocco whose little boy drowned, who saw the article that we published and then the video that was online with the article and called up. And I had her and the doctors start this. And then they finally came to New Orleans. And here is his story. It made it on CBS. Go ahead and play this video.
Well, drowning is the leading cause of death for young children in the U.S.
Survivors are often left with severe impairment and brain damage. For decades now, medical reporter Meg Ferris has covered families coming to New Orleans with hopes a treatment here could make even a small difference.
Well, now another family has come nearly 5,000 miles.
Last August, a parent's worst nightmare, a little boy learning to crawl, slipped out of his parents' view and into the pool. Shaima remembers her husband's devastating words.
I just remember him bringing him out of the pool and be like, that's it, it's done. Your brain just doesn't accept it. There is nothing in life that prepares you for that moment.
There was CPR. Aiden's heart stopped and started. He was on a ventilator. Doctors at the hospital in their home all the way in Casablanca, Morocco, gave him a 5% chance of living, but in a severely debilitated state.
The seizures just pushed him to a vegetative state where he was tube fed for a week. He had horrible spasticity, dystonic movements, not sleeping through the nights, not following with his eyes.
2 months later on the web, Shaima found our story on another toddler who nearly drowned and was treated with hyperbaric or pressurized oxygen. She called Dr. Paul Harch. He recommended to Aiden's doctors to give him special doses of bursts of nasal oxygen.
I've got 10 published studies on use of just intermittent supplemental oxygen in various other types of traumatic brain injury, for instance, stroke.
Still, the Moroccan doctors were skeptical.
After the first session, and I'm not kidding.
Look at the motor.
He was a completely different child. The spasticity completely disappeared. And after the second session, he was tracking with his eyes. Third one, smiling. Fourth one, laughing. And then he started interacting with us.
Now they've traveled more than 4,000 miles to get several weeks of pressurized oxygen treatments in Dr. Harch's tanks in Marrero.
I was telling him, sit up now. He couldn't do that before. The information is there that hyperbaric oxygen has beneficial effects on injured tissue. The American Heart Association came out and endorsed hyperbaric oxygen for acute heart attacks.
Her doctors told her oxygen treatments would not work. There are doctors in the U.S. who are skeptical as well. But she remembers well one doctor visit back home.
His neurologist literally called all the people working in his office to come check him out. They could not believe their eyes. And the physical therapist was like, I've never witnessed such a miracle in such short time.
Now the toddler, who was in a vegetative state from September to October, is already talking, playing with blocks, putting things in a cup, and handling his bottle on his own. Meg Ferris, Eyewitness News, Medical Watch.
The treatment center is in Marrero, but will be moving to Metairie in the coming weeks. Insurance usually does not pay for brain treatments. The child is getting weeks of daily treatments.
Worst fruits for your waistline.
Fruit to avoid, number one, ripe banana.
The doctors in
Half
Morocco
of a banana.
made the obvious observation.
Calories
Look
come
what
from
happened
sugar.
here.
And
Little Eden Carlson's neurologist, when they returned to Arkansas Children's Hospital, said, wow, I can't believe the change here. Well, we're going to see what happened. We're getting an MRI.
And that actually was the reason I was able to report the article. He got an MRI, and what we showed was global regrowth of brain tissue. And when he got the MRI back, he said, well, the only way I can explain this is that God did this. And I'm not going to argue with that. My answer was, this was a God-given therapy that was God-directed to be given to him. And that's how we got this result. And I really think that's what happened there. So, conclusions. Hyperbaric oxygen began as hyperbaric therapy, and it's 362 years old. But it's only since about 2010 that we finally understand the science. And it's a dual component drug. It's increased pressure and it's increased oxygen, which we are all sensitive to, every living organism. And when we do that, it acts like a drug, and we treat underlying disease processes that are common to many diseases. I even say that list of 132 may be a conservative list of indications. Most of the disorders, though, are wounding conditions or inflammatory conditions. And most pediatric neurological conditions actually can be considered wounding conditions of the brain. We're just not conditioned to think of them that way or educated about that. But there's now enough evidence to argue that this is evidence-based medicine for potentially many pediatric neurological conditions. But if you can't get hyperbaric therapy, you can start with normobaric oxygen. And the problem is you have to get your pediatrician or someone to write the prescription for the oxygen concentrator or a little tank to do it. Okay, that's that lake in Chile. Thank you.